Hi, this is Laura Patrick again, and I am joined by Deena Stewart, Digestive Health Nurse, and we're doing our Ask Deena videos this month, and the topic is winter bloating. Hopefully you aren't experiencing that, but if you are, we have some tips for you today. So Deena, talk a little bit about bloating and what that means.
Well, belly bloat is that uncomfortable feeling when maybe your pants are feeling kind of tight, your belt, you have to kind of loosen your belt. You might have distension or swelling or sticking out of the abdomen. You might have some cramping, abdominal pain, and gas.
Okay, so what are some causes of that?
Some of the main culprits for belly bloat are food. A lot of people have lactose intolerance, so they can't have dairy products. People that have celiac disease have a sensitivity to wheat and bread, things with gluten in it, so that can be a cause. People with inflammatory bowel disease, like ulcerative colitis, Crohn's disease, and irritable bowel syndrome also can have a lot of belly bloat as well. But certain conditions that are serious, like colon cancer, stomach, ovarian, and pancreatic cancer, also can have bloating as a symptom.
Okay, and I know I've heard you talk the last couple of days about winter belly bloat. What exactly do you mean when you say that? Or is it more common in the winter?
Well, there's really not a whole lot of science behind that to prove that the cold temperatures cause people to have more belly problems, but I do have a lot of patients that have irritable bowel syndrome and inflammatory bowel disease say that their symptoms are much worse in the wintertime. Some of the reasons for that could be dehydration. We simply don't drink enough water, especially in the wintertime. Inactivity or a decrease in your normal exercise routine. Also, people tend to drink more alcohol and use more tobacco during the winter months and things like that. So those can all be problems that lead to belly bloat in the wintertime.
Okay, and I know you touched a little bit on the water and the drinking, but what are some things that people can do to avoid this belly bloat?
Well, you need to kind of try and identify, is it a problem with food? Is it lactose intolerance? Is it gluten intolerance? Is it constipation? Drinking more water absolutely will help with that. Could it be medications that you're taking? There are lots of medications that can cause constipation, particularly opioid pain medications. But a change in the bowel habits actually needs to be something that you report to your doctor, because it could be a sign of a more serious condition, especially if it's something that's kind of sudden, and certainly abdominal pain. You need to have that checked out right away. And also, if you're 45 or older, now's the time to start talking about having that colonoscopy.
Right, exactly. And I know colon cancer month is upon us, so that is a good time to start thinking about that, especially at that age. Our digestive health team is fantastic, and Deena is fantastic. Thank you for being here today. If you have any other questions, feel free to reach out to Deena or our digestive health team here at King's Daughters. And that concludes our Ask Deena session this month. Have a good day.
Thank you.